I'd like to introduce Dr. David Janda. He's an orthopedic surgeon based in Ann Arbor, Michigan, and a member of a 9-member orthopedic surgery group. In addition, Dr. Janda is the director and founder of the Institute for Preventative Sports Medicine based in Ann Arbor, which is the only healthcare cost containment organization of its kind in North America. The books he's authored chronicle his efforts in the field of preventative sports medicine and outlines his approach on how to create a more available and more affordable healthcare system. He and the book, The Awakening of a Surgeon, have been featured guests on the Oprah Winfrey Show, and his research and prevention-based studies have been featured on many network television, radio, newspaper, and magazine presentations. These presentations have empowered the public by providing families and communities prevention information that can be used on an immediate basis to become safer and healthier. So it's my great pleasure to introduce Dr. David Janda.
Thanks, Rick. Well, I'd like to thank the Walkers and all of you for taking time out of your busy days to join me here tonight, especially on such a lovely evening. My goal tonight is to give you information that will empower you. It will immediately make you safer and healthier, and try to give you more knowledge on what we really need to do to make our healthcare system more available, more affordable, and more quality-oriented. And then we're going to talk about what's coming our way starting as early as next year with some of the changes. I'm not a politician. I'm also not a diplomat. I'm a grunt on the front line of healthcare delivery. I think it's important for you to know my background so you know where my point of view is coming from. I grew up in Chicago. Please don't hold that against me. I attended Bucknell University in Pennsylvania, obtained 2 degrees, one in chemistry and one in economics. I then went to Northwestern University Medical School and got my MD degree there. Then did my internship and residency in orthopedic surgery at the University of Michigan. And then I did my fellowship in London, Ontario, Canada, in shoulder reconstructive surgery and sports medicine. So I've experienced the national healthcare system in all its glory by taking care of folks through the Canadian system, and we'll talk about that briefly down the line. After leaving Canada, I came back to Ann Arbor and joined Orthopedic Surgery Associates based at St. Joe's. As Rich mentioned, I founded a nonprofit research institute, the Institute for Preventative Sports Medicine. It shouldn't be, but it is the only healthcare cost containment organization of its kind in the country and, in fact, all of North America. You see, it focuses on prevention, which I believe is the most critical component of healthcare reform in our country. You see, my experience in taking care of people over the past 29 years of my career is that whether it's the insurance companies or HMOs or federal government bureaucrats, they focus on one way to cut costs, and that is to manipulate care by denying the availability and access to care. In other words, rationing care. And what we've proven through our research at the Institute, if you're truly sincere about cutting healthcare costs, the most humane and the most ethical means of cutting costs is to prevent healthcare need, to make people safer and healthier. According to the federal government, just one of the studies that we've been involved with the Institute has prevented 1.7 million people from being injured every year and has saved $2 billion every year in healthcare costs. In that series of studies that led to those really positive results, we spent $1,000. We spend $1,000 once, and it saves $2 billion every year. The focus of that approach is prevention, not manipulation. I have advocated for healthcare reform for over 25 years. Healthcare reform that's ethical, that's humane, that focuses on prevention, that focuses on empowerment of each of us. Not empowerment of HMOs or insurance companies or government bureaucrats. Now, there are some folks that are going to be very upset as this evening goes along. I'm not sorry about that. The truth hurts. We're going to all have to deal with it, one way or another. One of the big problems I have with healthcare reform over the past 25 years is it has been presented to all of us as being a left, right, Republican, Democrat, liberal, conservative issue. Wrong axis. It's not on the x-axis. It's up and down. Up being freedom, down being oppression. And right now, all of us, and for the recent past, at least for the last 29 years that I can attest to, is that we have been oppressed by HMOs, insurance companies, and federal government bureaucrats that say to us when we can get treated, who we can get treated by, and if we can get treated. Unfortunately, as we'll get to later this evening, there's some legislation that we're all quite familiar with that passed in March of this year. I believe that scenario does not improve, and in fact, the oppression gets worse. And we're going to give you the facts about it. In medical school, when we start out, we learn about the normal, not the pathologic, not the diseased, but the normal. And we learn first about the normal, or what works, so that when we see the abnormal or the diseased, we can identify it. So right now, I believe our country is at war with itself. And we have a choice. The healthcare issue is the very tip of that spear where this war is occurring. It's the very front. What I want to do tonight to begin with is show you what we really need to do to make healthcare more available, affordable, and quality-oriented. Now, long story short, the way we do that is we take HMOs, insurance companies, and federal government bureaucrats out of the picture, and we put the finances back in each and every one of your hands so that you can decide where you treat with, who you treat with, when you treat, and if you treat. How do we get there? Well, let's start talking about it. There's first things we have to do to make this healthcare system that we currently have more available, more affordable, and more quality-oriented. And the first thing we have to do is we have to restructure the insurance industry. Now you can imagine the HMOs and the insurance companies don't like this part of the talk very much. First thing, we have to diminish paperwork. Minimum savings, $50 billion. There's some estimates up to about $125 billion we would save by cutting out the paperwork, or at least cutting it down. You know, one of the very positive things I saw when I worked in the Canadian system is when a patient came to see us, we had one form to fill out that went back to the government about what we did for that patient and what the charge was. In our office in Ann Arbor, we have a room about that size that are filled with about 400 forms for all the different insurance companies, for all the secondary claims, for all the tertiary claims when after they've been rejected the first and second times, because the longer they can postpone payment, the more money they make on the money they have in the bank. So the first thing we need to do is we need to get rid of the vast majority of the paperwork. And here's the key, and this is the key to it. We need to cut down on the administration side of medicine. It's been said that the minimum saving is $100 billion. It's a lowball number. It's probably close to $400 billion a year. For every doctor, nurse, and therapist combined, the providers of healthcare in this country, that have been added to the system over the past 3 years, there have been 3.5 administrators added for every one of us combined. The administration side of medicine is out of control. The vast majority of administrators, and this gets me in trouble also, have no functional medical knowledge. They don't provide care. They have no clue as far as what's important and what isn't. Their management skills are important, but their management skills, at times and many times, aren't appropriate to be applied to the medical practice and what we have to do to take care of people in a quality-oriented manner. So number one, we really have to strip down the administration side. Not just in hospitals, but in our clinics. I mentioned the 400 forms in our office. We have 30 employees that do nothing but file forms to insurance companies. Those costs are passed on, or at least used to be passed on years ago. Research facilities. When we look at research facilities, many people say to me, Dave, you run this nonprofit research institute. You don't get paid a penny to do it. You do things on a dime. I've had people from the federal government come to me and say, Dave, could you not publish so much because you use so little money, because we don't get any money from the government. We don't do that. We never have, never will, because we don't want to already overburden taxpayers. And we believe if you're doing high quality research that affects folks in a positive manner, that individuals and corporations and foundations will support that. I've been a little wrong on that, but the government has come to me and said, Dave, you do this at a fraction of the cost. We're handing out grants that what you do for $5,000, we're handing out grants for people for $5 million. Can you kind of stop or dial back a little bit? Because you're making everybody look bad. Well, why are their costs so high? Because when I go to these research institutes around the country and actually around the world, oh my gosh, it's just people dealing on the administration side, following forms about the research and where it's going and how it's going and reporting to the government and dealing with the government. It's crazy. It needs to be slashed across the board. In Michigan, we have a law called the Certificate of Need. Not every state has it. In fact, very few states have it. The Certificate of Need limits competition and raises costs for each and every one of us. You see, if, let's say, the second row of folks here decide that they want to put up an MRI scanner because they believe there's a need in Livonia, Michigan for another MRI scanner. Well, they couldn't do that because the Certificate of Need law blocks them from doing that. It restricts competition. And when it restricts competition, prices go up. Now, how do we know that's actually the case? Because states that have a Certificate of Need law and states that don't have a Certificate of Need law, their costs for MRIs in the states that don't have a CON law are half. So the Wharton School of Business out of Pennsylvania, prestigious school, did an analysis, and what did they find? God knows how much this study cost. They restricted supply and led to higher prices. I mean, all they had to do was look at prices in Michigan and prices in Ohio. But the public doesn't come off scot-free in this. One of the things we stress in our prevention research is personal responsibility. My father and my mother's generation were the epitome of personal responsibility. Everybody tries to put a handle on why they were the greatest generation. It's because of personal responsibility. They were responsible to each other. They were responsible to our country, to their neighbors, to their family, and to the world.